Hi, Dr. Randy Grill, nursing home dentist, and if you're watching this, you're a patient of mine, and this is critical information you may have never heard before. And the first thing I want to do is free you up from having to go to the sink, use toothpaste, have anything special but your brush, buy your bread, and a little Dixie cup. The reason why, the plaque that eats the food and it feeds off the sugar in your saliva, secretes acid and dissolves your teeth and your gums. So all you need is a toothbrush. It's the toothbrush bristles. The toothpaste just freshens your brush. If you will twice a day after breakfast and especially at night, and at night when you're tired, do not refuse the staff when they come and want to help you brush your teeth. But you must have the staff use what's called modified bass brushing. If you scrub back and forth, you're cleaning the clean surfaces of your tooth. All of the debris is either on the top of the tooth or on the gums of the tooth. And so all you need to do is, at a 45-degree angle, take the toothbrush with a very light pressure and just jiggle it like that and go down. And you just take every tooth. It's no big deal. You just sit there and gently, you can actually push back your gums like you push back the cuticles on your fingernails if you scrub back and forth, or you brush up and down like that. It has to be a very gentle 45-degree angle, and every tooth has to have that. Pam will be here. She's showing you this video on her iPad, and you just go around like this. Now I'm actually going to show you how I do it. I have my own toothbrush here. This, if I don't have toothpaste, I camp out a lot, and this is what I do. I take it, if you can, you may need a drink of water if you've got a dry mouth. I've got saliva. I'll just put it in. This is a new toothbrush. I just took it out of the baggie. I'll just put it in there, and I just kind of loosen up the bristles by putting it on the tops of my teeth and just kind of rubbing. If you go back and forth, it never cleans. It's like when you used to clean a floor. If you go use long strokes, it never gets into the little cracks and grooves. So I just go like that, and then I just put, with a pressure no lighter, I use the smallest brush I can get, and you need to use the smallest brush you can get. I have a cup here, so if I needed to spit, I can. No toothpaste. No bathroom. In your chair. You could do this in your bed. There's no excuse for not doing this. You just raise the bristles up here very gently, and just for 1 second, just kind of do a little scrub, not from tooth to tooth, and then you brush it down. You do this. And so I can sit there watching TV. I don't. It's nothing special. And when I need to spit, just spit. And I try to get every tooth for 1 to 2 seconds, and all the bacteria, the plaque that does all the damage to you, that rots your teeth, that rots your gums, is on the gum line. Brushing only gets 50% of the plaque. That's why you have to floss. But before you have a staff member floss, have me check your mouth to make sure that damage can't be done. Sometimes if there's a loose bridge, that even I, in flossing, can knock out a bridge. So here's how I'm going. I'm just going right here. I'm just, no big deal, going around. I'm going to go around all the top, and then I'm going to go on the back side. And it's a very light pressure, lighter than what I write on, because I don't want to push the gums back. And so I can sit here and talk to you and do this. Then later on, when there's a staff member, or your family's there, make sure you beg your family to brush your teeth. The more it gets done, the better it is. And have them know what's going on. They can have my phone number if they have any questions. Just have them talk to one of the nurses. The nurses always have her phone number. And you just go around like that. Do the lower back side. And when you get to the back side, okay? It's no big deal. Yes, take about 2 minutes, and 45-degree angle, light pressure, and then jiggle it down. This is called modified bass brushing. Do that all the way around. You go on the inside and just squirt it down. Use a small, soft bristle brush. Don't hurt yourself. And if you do it correctly, you'll probably have bleeding because that's getting rid of the infection. That's what you want. And you go around like that. After about 3 or 4 weeks, the bleeding will stop because your gums are going to get healthy. Do not expect the staff to do what they don't do for themselves. Most staff members that I knew, 99.9%, care about you, but they may not care about their own mouth. They may not know this. Maybe they can't afford to go to the dentist. You have a dentist. You know this. Don't expect from them what they don't do for themselves. You have to do it, and you have to direct it. And if they don't know how to do it right, you tell the nurse, and we will come out and show that staff member how to brush it. We also have videos for them on modified bass brushing. I care about you, and you must do this, and you must do it even when you're tired. And if you can, if you've got the dexterity, do it yourself. But tell the staff to do it. It's their job. It must be done. Love you. Thank you. Talk to you soon.